Elena's hands were the first thing Dr. Morrison noticed. Too precise, too steady, as if they had done something entirely different for years. But whenever he asked, Elena would just smile and change the subject. What happened that day in the operating room would change everyone's perception of Elena forever. From which city in the world are you watching this video today? If stories of hidden expertise and unrecognized excellence resonate with you, subscribe for more tales of extraordinary people hiding in plain sight. The morning fog hung thick over St. Mary's Medical Center as Elena Vasquez walked through the employee entrance at exactly 6:45 a.m. She had performed this same routine for 3 years, 4 months, and 16 days. The security guard, Marcus, offered his usual nod without looking up from his newspaper. To him, like everyone else at the hospital, Elena was simply another nurse, unremarkable, quiet, dependable. Elena's locker was numbered 247, tucked away in the corner of the staff changing room where few people ventured. She preferred it that way. As she pulled on her pale blue scrubs, her movements were economical, practiced. Everything about her radiated competence, yet she remained virtually invisible to her colleagues. The morning huddle took place in the main nursing station. Charge nurse Patricia Williams stood at the center, clipboard in hand, addressing the day shift. Elena positioned herself at the back, as always, listening but not participating in the casual conversations that preceded the official briefing. "We have 3 scheduled surgeries today," Patricia announced. Dr. Morrison is performing a cardiac bypass in OR 3. Dr. Chen has an emergency appendectomy in OR 1. And Dr. Rodriguez is handling a gallbladder removal in OR 2. Elena made mental notes, though none of these cases would directly involve her. As a floor nurse, her responsibilities kept her in the general wards, managing patient care, administering medications, and handling discharge procedures. She had never been assigned to surgical support, never requested it, never shown interest in it. Dr. James Morrison arrived at the nursing station 20 minutes later, coffee in hand, looking over the day's surgical schedule. At 52, he was one of the hospital's most respected cardiac surgeons, with a reputation for perfectionism that intimidated most staff members. His gray eyes swept over the assembled nurses with professional assessment. "I'll need 2 experienced surgical nurses for the bypass procedure," he announced. "Mrs. Patterson and Nurse Kelly, you're with me." As the group dispersed, Dr. Morrison's attention was drawn to Elena, who was quietly organizing patient files at a nearby desk. Something about her posture, the way she handled the documents with such precise care, struck him as unusual. Her hands moved with a surgeon's economy of motion, each gesture deliberate and controlled. "Excuse me," he said, approaching her desk. "Elena, isn't it?" She looked up, meeting his gaze with calm, intelligent eyes. "Yes, Dr. Morrison, how can I help you? I've noticed you handle paperwork with remarkable precision. Have you worked in surgery before?" A ghost of a smile crossed Elena's face. "Just general nursing, doctor. Would you like me to prepare anything specific for your procedure today?" Something in her deflection intrigued him further. Most nurses would have elaborated, mentioned their training or previous positions. Elena's response was carefully minimal, as if she were deliberately avoiding the subject. "No thank you, but I'm curious about your background. Where did you train?" "Here and there," she replied, returning her attention to the files. "Different places, different times." Dr. Morrison studied her for another moment. The way she avoided eye contact, the practiced neutrality of her responses, the subtle tension in her shoulders, all suggested someone with something to hide. But what could a floor nurse possibly be concealing? Throughout the morning, Elena moved through her routine with the same quiet efficiency she had maintained for over 3 years. She checked on Mrs. Henderson in room 302, administered pain medication to Mr. Garcia in 315, and helped with the discharge of teenage patient Sarah Collins, who had recovered from pneumonia. But twice during her rounds, She found herself pausing near the surgical wing. The sounds emanating from the operating rooms, the steady beeping of monitors, the controlled urgency of surgical teams, seemed to draw her attention in ways she couldn't quite explain to herself. At 11:30 a.m., Elena was updating patient charts when the hospital's emergency alarm system activated. The sharp, piercing sound echoed through every corridor, followed immediately by an announcement over the intercom. Code Blue Oregon 3. Code Blue Oregon 3. All available medical personnel to OR 3 immediately. Elena's pen stopped moving. OR 3 was Dr. Morrison's cardiac bypass surgery. She looked up to see nurses and doctors rushing past her station, their faces tight with concern. Code Blue meant cardiac arrest, possibly death imminent. For a moment she remained frozen at her desk, fighting an internal battle she had been waging for over 3 years. Then, without fully understanding why, she stood up and walked toward the surgical wing. The scene outside OR 3 was controlled chaos. Nurses wheeled emergency equipment through the doors, while Dr. Morrison's voice could be heard barking orders from inside. Through the small observation window, Elena could see the surgical team working frantically around a patient whose heart monitor showed the irregular, chaotic rhythm of ventricular fibrillation. "We're losing him," came Dr. Morrison's strained voice from inside the room. "Where's cardiology backup? Dr. Patterson is in surgery. Dr. Williams is with another emergency," replied a voice Elena didn't recognize. "Manual compressions aren't working. The cardiac tissue is too damaged from the initial procedure." Elena stood perfectly still outside the OR, her training warring with her carefully constructed anonymity. 3 years of hiding, 3 years of keeping her head down, 3 years of being nobody special. But inside that room, a man was dying, and she possessed knowledge that could save him. Her hand moved toward the OR door, then stopped. Once she crossed that threshold, there would be no going back. Questions would be asked. Her past would be scrutinized. The careful life she had built would unravel. Time of death, 11:47 a.m., came Dr. Morrison's defeated voice from inside. Elena's hand pushed open the OR door. The surgical team looked up in surprise as she entered, still wearing her regular floor nursing uniform instead of surgical scrubs. Dr. Morrison's eyes widened with confusion and irritation. "Elena, what are you doing here? This is a sterile environment." "You said cardiac tissue damage," she said quietly, moving toward the surgical table. "What type of damage?" "I don't have time to explain medical procedures to floor nurses," Dr. Morrison snapped, his frustration and grief evident. "Please leave immediately." Elena ignored him, studying the patient's exposed chest cavity with an intensity that surprised everyone in the room. Her eyes moved with the practiced assessment of someone who had seen similar situations many times before. "The left anterior descending artery," she said, her voice carrying a new authority that none of them had heard before. "There's a tear just proximal to the first diagonal branch. You tried to repair it with a simple suture, but the tissue is too friable." Complete silence fell over the operating room. Dr. Morrison stared at her, his anger replaced by shock. "How could you possibly know that?" "Because I can see it from here," Elena replied simply. "And because I've repaired dozens of similar tears using a different technique." "That's impossible. You're a floor nurse." Elena met his gaze steadily. "I was other things before I was a floor nurse." Dr. Morrison looked at his patient, then back at Elena. The man on the table was officially dead, but Elena's assessment had been unnaturally accurate. Something about her certainty, her clinical detachment, suggested knowledge far beyond her apparent position. "What technique?" he asked quietly. "Patch repair with pericardial tissue and interrupted horizontal mattress sutures with pledgets. But you need to work fast. He's been down for 3 minutes. Dr. Morrison," interrupted Nurse Kelly. "Hospital protocol doesn't allow." "Hospital protocol doesn't account for situations like this," he replied, never taking his eyes off Elena. "What makes you think this will work?" "Because I performed this exact repair on a patient in Kandahar who had taken shrapnel to the chest. Similar tissue damage, similar complications." He walked out of that field hospital 2 weeks later. The room fell silent again. Kandahar meant military deployment, combat medicine, surgical experience under the most extreme conditions possible. Dr. Morrison made a decision that would either save a life or end his career. "Scrub in," he ordered. Now, Elena moved with sudden urgency, her 3 years of careful anonymity falling away like a shed skin. As she scrubbed her hands and arms with practiced efficiency, her entire demeanor transformed. The quiet, unremarkable floor nurse disappeared, replaced by someone with the focused intensity of a combat surgeon. When she returned to the OR properly gowned and gloved, she moved to the surgical table with an authority that surprised even Dr. Morrison. Her hands, those precise hands he had noticed earlier, positioned themselves over the patient's chest with absolute confidence. "Pericardial patch," she requested, and Nurse Kelly handed her the tissue graft without question, apparently mesmerized by Elena's transformation. "Suture material, 4-methyl-proline with pledgets," Dr. Morrison provided, now watching Elena work with fascination rather than skepticism. Elena's hands moved with a surgeon's precision, but with something more, an economy of motion that spoke to experience in high-stress environments where every second mattered. Her sutures were perfect, placed with a speed and accuracy that left the surgical team speechless. "Defibrillation pads," she said without looking up from her work. As the electrical shock coursed through the patient's body, the heart monitor showed a brief flutter, then nothing. Elena continued her repair work, unfazed. "Again," she ordered. The second shock produced an irregular rhythm that gradually strengthened into a normal sinus pattern. The patient's blood pressure began to stabilize, and his color started to improve. "My God," whispered Dr. Morrison. "It's working." Elena completed her repair with the same methodical precision she had shown throughout the procedure. Only when the patient's vital signs had fully stabilized did she step back from the table. "The repair should hold," she said quietly. "Monitor for bleeding and arrhythmias, but the tissue looks viable." Dr. Morrison stared at her, his mind racing with questions. "Elena, what exactly was your position in Kandahar?" She met his gaze for a moment, then looked away. "I should get back to my regular duties." "That's not an answer." Elena began removing her surgical gown, her movements once again economical and precise. "Some things are better left in the past, Dr. Morrison." "Elena, wait." His voice carried new respect, new urgency. "What you just did, that was extraordinary surgical technique. You saved a man's life using skills I've rarely seen outside of specialized cardiac units." She paused at the OR door. "I was a combat surgeon. 2 tours in Afghanistan, 1 in Iraq. Field hospitals, forward operating bases, places where you learn to fix everything or watch people die." The revelation hung in the air like a tangible presence. Everyone in the room was reassessing everything they thought they knew about the quiet floor nurse who had worked among them for 3 years. "Why didn't you tell anyone?" Nurse Kelly asked quietly. Elena's expression grew distant. "Because I came here to be nobody special. To have a quiet job where the stakes weren't life and death every single day. Where I could help people without having to make decisions about who lived and who died." "But you made that decision today," Dr. Morrison pointed out. "Today was different. Today someone was dying, and I was the only one who could help." She looked back at the patient, whose chest now rose and fell with steady, regular breaths. "I couldn't just stand there and let it happen." Dr. Morrison followed her toward the door. "Elena, we need to talk. The hospital needs to know about your qualifications. You could be heading our trauma surgery program, teaching other surgeons." "No," she interrupted firmly. "What happened here stays here. I go back to being a floor nurse, and life continues as it was." "That's impossible now. Word will spread. People will ask questions." Elena paused with her hand on the door handle. "Then I'll find another hospital, another city, another place where I can be nobody special." "Is that really what you want?" he asked gently. "To keep hiding from who you are?" For a moment, her composed facade cracked, revealing something vulnerable underneath. "Dr. Morrison, in 3 tours of combat surgery, I saved a lot of lives. But I also lost a lot of patients. Young soldiers, kids really, who died on my table despite everything I could do. When I came here, I thought I could help people without carrying that weight anymore." "But you still carry it."
he observed. Every day, she admitted quietly. But here, when Mrs. Henderson needs pain medication or Mr. Garcia needs someone to listen to his fears about his diabetes, those are problems I can solve without wondering if I made the right call under fire. Dr. Morrison studied her face, seeing the emotional toll of years spent making life and death decisions under the most extreme circumstances imaginable. Elena, what you did today, that was a gift. You have abilities that could save countless lives. And today I used those abilities, she replied. One life saved, that has to be enough, does it? She didn't answer, pushing through the OR door and walking back toward the general ward. But something had changed irrevocably. The other nurses and doctors in the corridor looked at her differently now, with a mixture of respect and curiosity that had made her invisibility impossible to maintain. Over the following days, Elena attempted to return to her routine. But the hospital had fundamentally changed around her. Word of the emergency surgery had spread throughout the medical staff, despite Dr. Morrison's attempts to keep the details confidential. Nurses who had worked beside her for 3 years suddenly viewed her with new eyes. Doctors began asking for her opinions on complex cases. The chief of staff requested a meeting to discuss her background and qualifications. On Thursday morning, exactly 1 week after the surgery, Elena found Dr. Morrison waiting by her locker when she arrived for her shift. How is he? She asked without preamble. Recovering beautifully. The repair is holding perfectly, and his cardiac function is better than we dared hope. She nodded, pulling on her scrubs with the same methodical precision she had always displayed. Elena, I've spoken with the chief of staff. We want to offer you a position in our cardiac surgery program. Full privileges, attending status, competitive salary. No thank you, you haven't heard the details. I don't need to hear them. My answer is no. Dr. Morrison leaned against the lockers, studying her profile. Can I ask you something? She continued dressing without responding, but he took her silence as permission to continue. In Afghanistan, when you lost patients, was it because you weren't skilled enough, or because the injuries were simply too severe? Elena's hand stilled for a moment on her locker door. What difference does it make? Because I think you're punishing yourself for losses that weren't your fault. Combat medicine means treating injuries that would be fatal in civilian hospitals even under optimal conditions. The fact that you saved anyone at all under those circumstances makes you extraordinary. Extraordinary people don't run away to hide in small hospitals, she replied. Maybe they do when they need time to heal from trauma that would break most people. Elena closed her locker and faced him fully. Dr. Morrison, I appreciate what you're trying to do, but I've made peace with my choices. Have you? Because what I saw in that OR wasn't someone who had given up on surgery. That was someone who still had the fire, the skill, the passion for saving lives. Before Elena could respond, Nurse Patricia Williams appeared around the corner, slightly out of breath. Elena, thank God you're here. We have a situation in the ER. Multi-vehicle accident, several trauma cases coming in. Dr. Rodriguez is requesting all available personnel. Elena felt the familiar surge of adrenaline that accompanied emergency situations. Despite her attempts to avoid high-stakes medicine, her body still responded to the call of crisis with automatic preparation. I'll be right there, she told Patricia, then looked back at Dr. Morrison. This conversation isn't over, is it? Not by a long shot, he confirmed. The ER was controlled chaos when Elena arrived. 3 ambulances had brought in victims of a highway collision, including a family of 4 whose car had been struck by a drunk driver. The parents were conscious but injured, while their 2 children, ages 7 and 9, were in critical condition. Dr. Rodriguez was triaging patients with efficient ruthlessness, sending the less severely injured to treatment rooms while focusing on the life-threatening cases. The 7-year-old girl had internal bleeding, while her 9-year-old brother showed signs of traumatic brain injury. Elena, I need you with the girl, Dr. Rodriguez called out. Prep her for emergency surgery. Possible splenic laceration. Elena moved toward the treatment bay where the child lay unconscious, her small face pale against the stark white pillow. The girl's parents stood nearby, the mother crying while the father held her, both of them looking helplessly at their injured daughter. As Elena began checking the child's vital signs and preparing EV access, she heard Dr. Rodriguez speaking urgently into his phone. "I need a pediatric surgeon here now." "What do you mean 2 hours? This child doesn't have 2 hours." "No, I understand you're in another surgery, but..." Elena looked up from her patient. "How long until pediatric surgery arrives?" 2 hours minimum. Dr. Peterson is in a complex procedure at Children's Hospital, and Dr. Yang is dealing with another emergency case. Elena studied the child's monitor readings. Blood pressure dropping, heart rate increasing, signs of internal bleeding that would require immediate intervention to prevent death. "What about general surgery?" she asked. "I can handle the procedure, but I've only done 3 pediatric cases in the past 5 years. The anatomy is different. The margin for error is much smaller." Elena's hands continued their automatic assessment of the patient, checking pupil response, palpating the abdomen, evaluating the child's overall condition. Her training told her everything she needed to know about the girl's prognosis without immediate surgical intervention. "Dr. Rodriguez," she said quietly, "I need to speak with you privately." They stepped away from the treatment bay, out of earshot of the distraught parents. "She has maybe 30 minutes before the bleeding becomes irreversible," Elena said without preamble. "I know I'm preparing to take her to surgery, but I have to be honest, pediatric trauma surgery isn't my specialty." Elena was quiet for a moment, wrestling with the same internal conflict she had faced a week earlier in the cardiac. "I've done this procedure before, multiple times, on children her age under much more difficult conditions." Dr. Rodriguez stared at her. "Elena, what are you saying?" "I'm saying that if you want the best chance of saving this child's life, you should let me do the surgery." "That's impossible. You're not credentialed for surgery at this hospital." "The liability issues alone, Dr. Rodriguez, that little girl is going to die if someone doesn't operate on her in the next 20 minutes. You can explain the liability issues to her parents after the funeral." The bluntness of her statement hit him like a physical blow. He looked back toward the treatment bay, where the child's mother was stroking her daughter's hair while whispering prayers. "Elena, if this goes wrong, both of our careers are over. If we don't try, she's dead anyway." Dr. Rodriguez closed his eyes for a moment, weighing impossible choices. When he opened them, his expression had changed from uncertainty to grim determination. "What do you need?" 30 minutes later, Elena stood in OR2, once again transformed from invisible floor nurse to combat surgeon. The child lay before her, small and fragile under the surgical light, but Elena's hands moved with the same confident precision she had displayed during the cardiac case. Dr. Rodriguez assisted, following Elena's clear, calm instructions as she located and repaired the damaged spleen. Her technique was flawless, her movements economical and sure, her knowledge of pediatric anatomy comprehensive. "Clamp," she requested, and Dr. Rodriguez provided it instantly. "Suture material. 4-0 Vicryl." Elena worked in the focused silence that characterized all of her surgical procedures, speaking only when necessary, moving with the efficiency of someone accustomed to operating under extreme time pressure. "There," she said finally, completing the repair. "The spleen is intact and the bleeding has stopped. Her vital signs should stabilize now." As if responding to her words, the child's blood pressure began to improve, and her heart rate decreased to a more normal range. "Elena," Dr. Rodriguez said quietly, "that was extraordinary. Where did you learn pediatric trauma surgery?" "Field hospitals treat everyone," she replied simply. "Soldiers, civilians, children. You learn to adapt your techniques to whatever comes through the door." An hour later, Elena sat in the family consultation room with the child's parents, explaining their daughter's condition and prognosis. The surgery had been successful, and with proper recovery time, the girl should make a complete return to normal health. "Thank you," the mother said through her tears. "Thank you for saving our baby." Elena nodded, uncomfortable with the gratitude as always. "She's a strong little..." She did most of the work herself. As the parents left to return to their daughter's bedside, Dr. Morrison appeared in the doorway of the consultation room. "Word travels fast in a hospital," he said, taking a seat across from her. "2 surgeries in 1 week. I think my anonymity is officially over." "Elena, you can't keep pretending this is coincidence. Twice now, You've been in the right place at the right time to save lives that would have been lost without your intervention. Twice now, I've made choices I swore I wouldn't make anymore. Dr. Morrison leaned forward. Maybe that's because those choices are part of who you are. Maybe trying to suppress that part of yourself isn't healing. It's just another form of trauma. Elena was quiet for a long moment, staring out the consultation room window at the city. Dr. Morrison, do you know why I really left military medicine? Tell me. There was a mass casualty event, suicide bomber at a market in Kabul. We received 47 patients in 6 hours, everything from minor shrapnel wounds to traumatic amputations. I performed 16 surgeries that day, working for 22 hours straight. She paused, her voice growing softer. I saved 39 lives, but 8 people died on my table, including a 12-year-old boy who had been buying bread for his family when the bomb went off. Dr. Morrison waited, understanding that she needed to finish the story in her own time. Logically, I knew that 39 saved out of 47 was an incredible success rate under those conditions. Any other surgeon would have lost twice as many. But all I could think about were those 8 faces, especially the boy. I started questioning every decision, second-guessing every technique, wondering if I could have done something different. That's not unusual for surgeons who deal with trauma, Dr. Morrison said gently. The ones who care about their patients often struggle with the losses more than the saves. I know, but it got worse. I started making mistakes, hesitating during procedures, losing the confidence that had made me effective. My commanding officer ordered me to take leave, get psychological counseling. When my tour ended, I decided not to re-enlist. And you came here to get away from life and death decisions. I came here to help people in ways that didn't require me to choose who lived and who died. Floor nursing felt safe, predictable. No one dies if I'm a few minutes late with pain medication. Dr. Morrison was quiet for a moment, processing her story. Elena, what you experienced, that's moral injury. It's different from PTSD, but just as real. You're not broken or inadequate. You're someone who cares so deeply about saving lives that the losses affected you more than most people could handle. Caring doesn't bring back the dead. No, but it's what makes you an exceptional surgeon. The doctors who don't feel that weight are the ones I worry about. Elena looked at him directly for the first time during their conversation. Dr. Morrison, even if you're right about all of this, I don't know if I can go back to being responsible for those kinds of decisions every day. What if you didn't have to? What if you could choose when to use those skills, when to step in and when to step back? What do you mean? Consulting position. You maintain your floor nursing duties, but when we have cases that require your specialized expertise, you're available. No pressure to take every case, no requirement to work surgery full-time, just the option to save lives when you feel ready to do so. Elena considered this proposal. It wasn't the complete anonymity she had sought, but it wasn't the high-pressure environment of military medicine either. A middle ground that might allow it help people without drowning in the weight of constant life and death decisions. I'd want clear boundaries, she said finally. I choose which cases to take. No pressure, no guilt if I decline, and my primary responsibility remains floor nursing. Agreed. And no publicity, no articles in medical journals, no presentations at conferences. I help when I can, but I don't become a poster child for trauma surgery. Also agreed. Elena stood up, extending her hand to Dr. Morrison. Then I accept your offer. As they shook hands, Elena felt something she hadn't experienced in 3 years, a sense of purpose that didn't require her to choose between helping people and protecting her own emotional well-being. She could remain the quiet floor nurse most of the time, helping patients with their daily needs and recovery. But when someone needed the skills she had developed in combat zones, she could step forward without having to commit to a life of constant high-stakes surgery. 6 months later, Elena had found her balance. She continued her floor nursing duties, taking care of patients like Mrs. Henderson and Mr. Garcia, finding satisfaction in the small ways she could ease their discomfort and speed their recovery. But she had also performed 12 surgical consultations, saving lives that would have been lost without her unique combination of skills and experience. The hospital staff had adapted to her dual role, respecting both her privacy and her expertise. She was no longer invisible, but she wasn't defined solely by her surgical abilities either. She had become Elena Vasquez's floor nurse and occasional surgical consultant, someone who had found a way to use her gifts without being consumed by them. On quiet evenings, when she walked through the hospital corridors during her rounds, Elena sometimes paused near the surgical wing. But now, instead of feeling the weight of decisions she was trying to avoid, she felt the satisfaction of knowing she could help when needed, while still maintaining the peaceful routine that had allowed her to heal from her combat experiences. She had learned that hiding from who you are isn't the same as healing from what you've experienced. Sometimes, the path forward requires finding new ways to be yourself, rather than trying to become someone entirely different. The hands that Dr. Morrison had first noticed, those precise and steady hands, still moved with surgical precision. But now they served wherever they were needed most, whether administering medication to a worried patient or saving a life in the operating room. And Elena had finally made peace with both sides of who she was.